My name is Hiba Omar. I'm a third year nursing student at OTTERBEIN University, and today I will be discussing trends in mental health help-seeking behaviors among Black college students. Black college students experience disproportionately high mental health support needs compared to their peers, according to the Boston Congress of Public Health Review. Cultural perceptions of mental health, stigma, discrimination, and a shortage of Black mental health counselors can prevent students from seeking help. When support is affordable, easy to access, and designed to reduce barriers, students are equally likely to take advantage of the resources available to them. By recognizing why some students may hesitate to seek support, institutions can develop services that are more effective in meeting the diverse needs of their campus communities. Our participants consisted of three racial categories: by multiracial, Black, and white college students. For the study, we used the ACHA NCHA 3 questionnaire, which was distributed at participating colleges and universities. The survey was voluntary and confidential, and incentives were offered to help encourage participation. Analysis conducted in SPSS version 26 with descriptive statistics examining mental health service use by race. We also used the chi-square tests to assess relationships between service location and race. Looking at on-campus mental health service use, Black students use these services the most, peaking at 66.9% in 2020. However, they also experienced the sharpest decline in usage compared to other racial groups over the years. Bi multiracial students relied on-campus services the most in 2023, with 47.6% using them, while white students consistently had the lowest rates of on-campus service use across all the years we examined. Next, focusing on near-campus providers, Black students' use increased by 9.5% from 2021 to 2023. In all 4 years assessed, bi multiracial students saw a slight decline of 1.1% in use, while white students consistently showed the highest engagement with near-campus services across all years. Overall, we see an increase in use of local community or near-campus mental health providers among Black students. Finally, examining hometown mental health providers, white students consistently reported the highest usage from 2020 to 2023, peaking at 49.4% in 2022. Black students followed, peaking at 43.8% in 2023. Importantly, Black students showed the largest upward trend over this period, with a 15.1% increase in hometown provider use from 2020 to 2023. Overall, our analysis shows that Black students consistently relied on on-campus counseling services more than any other racial group. Although the use of on-campus counseling services decreased over the years, it remained the most frequently used option among Black students. The good news is that over the years, there has been a steady increase in the use of near-campus and hometown mental health providers. This trend may reflect a search for services that are more culturally responsive, as students may feel that off-campus or hometown providers better understand their unique experiences and needs. Several factors likely contribute to the gradual decline in on-campus service use. The increase in hometown provider use by Black college students could be due to increased accessibility, improvements in the quality of local mental health services, or greater availability of culturally competent care in their home communities. It's also important to note that our dataset did not capture virtual or telehealth services, which could have influenced these trends and may represent an important avenue for future research or program development. Services provided by colleges should be culturally relevant and designed to support students from diverse backgrounds. Expanding access to culturally competent providers, addressing structural barriers, and incorporating virtual or telehealth options could help increase engagement and reduce disparities in mental health care. A key question for future study is whether Black students would continue to rely primarily on on-campus counseling if culturally competent services were expanded, or if trends toward near-campus and hometown providers would persist. Additionally, future research should examine how satisfaction with on-campus mental health services differs for Black students attending historically Black colleges and universities versus predominantly white institutions, with a particular focus on the role of culturally representative providers. Thank you very much.